This is Kupuna Connections, brought to you by Kapi'olani Community College's Kupuna Education Center.
Hi, my name is Ann Lowe. I'm a physical therapist of many years' practice. I teach in the Physical Therapist Assistant Program at Kapi'olani Community College. First basic principle is to take care of yourself. So you need to have good firm shoes on, no slippers when you're transferring somebody. You need to make sure that the person you're going to transfer is prepared for the transfer. They know what's going on, they don't get confused. And the third thing is to get them close to you, because if you're not close to them, you don't have any control over the transfer. Everybody says keep a straight back, but straight back really isn't the right term. You actually need to have a little hollow in your back, and you need to use your legs and not your back when you lift. So you need to have strong legs. Organize the space, because if you're tripping over things and things are getting in the way or the chair's not in the right place, you're going to have to stop in the middle and restart, and that could be dangerous for you to get ready. Other thing is make sure that you're ready yourself. You've mentally run through the transfer and you understand how it's going to go. And then also, as I said before, your family member should be ready and understand what's going to happen.
Down towards the foot of the bed.
In order to roll somebody from side to side in bed, you have to have the body weight move easily. Very often you're trying to teach them to do it by themselves. So there's a couple of different ways you can encourage them to roll by themselves. First one is if you are going to roll to the left, you cross the right ankle over the left ankle and ask them to reach their right hand across the top of the body to reach to the opposite side of the bed. And then you just gently help them by holding them on their hips and their shoulders and gently help them roll. That's one way. Second way, which makes them even more independent, because we can use the weight of the legs, is to bend the knees up, have them bend their knees up, both of the knees up, and then let the knees roll to the side they're going to roll, and the body just automatically comes with the knees because they're weighing you down, and then they just reach across for the edge of the bed. And that usually is a little easier on both the patient and the caregiver. Often people, when they're lying in bed, they slide to the bottom of the bed and then they have no way of getting back up again. So we try and teach them how to do that with some help or without. They can sometimes do it independently. And the first thing to teach them to do is to bridge. They need to bend their knees up until their knees are bent to 90 degrees, put their feet flat on the bed, and then just lift up their okole. And then they're going to scoot their weight back by pushing on their feet. Let themselves down, bring their feet back a little more, and repeat the same thing until they've got to the top of the bed. Same thing applies if they're going to move from side to side in the bed. Sometimes they get scooted over to one side of the bed too much, and you want them to be more in the middle. They can do the same thing. Bring the feet up, put the feet flat on the bed, bridge by lifting up their okole, and just move their okole over to where it should be, and then bring the other parts of the body with them. A gait belt is a thing that originally was used in hospitals to make sure that patients didn't fall and that the person who was walking with them had some kind of firm control over them. A lot of places used to hang on to people's belts or the waistbands of their pajamas, and that's very uncomfortable if somebody falls. You can give them a wedgie, and that's not very comfortable. If you have a gait belt, it's a canvas belt that goes around the waist and is cinched up fairly tight. And the person who's walking that person or moving them has hold of the belt and not the person's body. Often elderly people are rather fragile. They have fragile skin, and if you grab onto their skin, it will often tear or bruise. It's much better to be holding onto something firm.
で、肩と首の補助してそのままありがとう。大丈夫ですか？はい。
Anytime that you are getting somebody in or out of a wheelchair, there are two important things that you need to remember. One is the wheelchair needs to be locked. Okay. The reason for that is if you sit down on the wheelchair or your elder sits on the wheelchair and it's not locked, it could slide away from behind them and they'll end up on the floor, and could break a hip. So that's important for first thing. And the second thing is that the footrests need to be up and out of the way before the person gets in or out of the wheelchair. Getting into the wheelchair, they shouldn't be stepping over footrests to get in. So the footrests need to be flipped out to the side and out of the way. Getting out of the wheelchair, if they step on the footrests, they will tip the wheelchair forward and they will fall out of the wheelchair to the front. So those are the two main safety items that you have to remember with wheelchairs. Wheelchairs come very standard from Medicare. A basic wheelchair will have probably arms that come off so that you can slide transfer. Probably will have footrests that don't necessarily swing away and get out of the way. Wheelchairs need to be fitted by a professional. So the person who you buy it from should also fit the client to the wheelchair, because there's many sizes and many shapes and they have different functions depending on the client's need. And I think you probably want to get together with either an occupational therapist or a physical therapist to decide what those options are, because often you don't know if you've never had your family member in a wheelchair before. Some of the things that are very useful are the arms that come off, armrests that come off, armrests that go under a table. They're called cutaway arms, which means that the family member can actually sit close enough to the table to eat or to work at a desk or do something of that nature, and those are not standard. Leg rests that elevate might be a good idea if somebody has swelling in their feet a lot and you want them not to be so dependent. Amputees need different kinds of wheelchairs, adaptations for the lower part of their wheelchair, and then definitely footrests that swing out of the way and come off. This makes things like car transfers much easier and transfers into bed much easier, because you can get the chair closer to the bed without the leg rest being in the way. And wheelchairs come in different varieties, just like the assistive devices are, and very often you will get what we call a standard wheelchair that may not have all the features you need. So I'm going to go through some of the features that you might be looking for on a wheelchair. Fairly basic. It has what we call breakaway legs. In other words, you can take the leg rests off if they're in the way, which is nice when you're doing car transfers or things like that, and they go back on and then they swing back into place, which is nice. Each wheelchair has what we call wheel locks. These aren't brakes, they don't slow you down, they lock the wheels. And it's very important that the wheel locks work. Every time somebody gets in or out of a chair, they need to have the wheel locks locked, and they need to have the footrests up out of the way. Those are two very important safety devices. Most of these wheelchairs that we have here are self-propelling. In other words, the person can sit in the chair and push themselves around. You've got the actual wheel, and then you've got a hand rim, which is what they actually push from. And that's how they move themselves around. This particular chair has what we call regular armrests. They're just the same length. This is just armrests for resting on. Unfortunately, if you're sitting at a dining room table, you can't get your chair underneath the table. The wheelchair at the end there has what we call cutaway arms, or desk arms. They cut away at the front so that you can slide it under the desk or under the table. Now these are removable. So sometimes we will want to turn them around so they look like this. And the reason for this might be that if somebody is pushing themselves around a lot, this gets uncomfortable under the arm, and this gives a place for the arms to be so that they can move themselves around. Okay, so these are reversible and they can be changed. The difference between this chair and this chair, apart from the armrests, is the foot pieces. On this one, the foot pieces don't raise. On this one, you can actually raise up the leg. So if you want to support the leg in more elevation, it can be raised and supported on here. They're still breakaway, they still come off. It's just they're a little more complicated. The most important thing when transferring an elder from the bed to the chair is to organize first, to get everything available and ready. You're going to need the chair, and it's going to need to be close to the bed, in fact right up against the bed. You're going to need a gait belt, you're going to need some kind of footwear that is non-slip. Slippers don't work because slippers either catch on the floor or the person slips out of them. They should either have shoes on or non-slip socks. And non-slip socks have the little rubber bottoms to them, and those actually work the best. Second part of the organization, once you've got all the bits and pieces that you need there, is to tell your elder what you're going to do. That we're going to get up and we're going to get out of bed, so they know that they can help. Third thing to do would be to get them sitting up on the side of the bed. They'll roll just like we taught them, drop their legs off the edge of the bed and sit up with your assistance. At that point, you can put the gait belt on and make sure that's in place if they have balance. If they don't have balance, then put the gait belt on before they sit up. Okay? Shoes should be on or socks should be on. If you have a hospital bed that will raise and lower, it's nice then to get the bed down as low as you can so their feet are on the ground. If you don't, then you're going to have to scoot them to the edge of the bed so that their feet are touching the bed floor, because you don't want them to be kind of dropping down onto the floor as they're standing up. Next thing to do is make sure that the elder can see where they're going. So their face is going to be facing towards the way that they're going. So if they're going to transfer to a chair on the right-hand side, your right-hand side, then they're going to be facing the chair so they can see it. Then instructions. We're going to rock 3 times. On the 3rd time, you're going to stand up and I'm going to help you. And then we're going to turn and sit in the chair. Once you see the chair, you can reach across and grab the armrest so that when you sit down, you'll sit down gently. Once the explanation is done, then we just go ahead and do it. One of the problems with going back to bed sometimes is that, from a wheelchair, is that the bed and the wheelchair are different heights. Very often beds at home are a little higher than the wheelchair. Coming out of bed, that's an advantage because you're coming down. Going back into bed can be a little bit more difficult because you have to get them up higher in order to get their okole on the bed. Couple of different things you can do here. One, you could stand them on a stool and get them step onto a stool and then get onto the bed, and that depends on how stable they are. The second thing is you're going to have to lift them to some degree. Once they're standing up out of the wheelchair, you're going to have to lift them slightly to just get their okole on the edge of the bed. Once you've got them there, you can block their feet with your own feet, and then you can gently move one side of their body back onto the bed and kind of rock them backwards and forwards until you've wiggled them back onto the bed. So the ideal, of course, is to get a bed that goes up and down. Transferring into a car is not much different than transferring from one chair to another. The only thing that's important is to make sure that the wheelchair is firmly locked. The footrest is off that's next to the car, otherwise you're going to scratch your car up or you're going to scratch the elder's legs up as they try and get around the footrest. So take the footrest off before you start. And then let the elder hold on to any part of the body of the car that they feel comfortable with. Transfer is exactly the same. It's a pivot transfer. We would stand up, turn their back towards the car, and then as they go in, make sure that their head comes well down so they don't bang their head on the top of the car door frame, and sit them down. Once they're sitting on the chair, then it's just a question of turning them, pivoting them around and having their legs go into the car. Depends on the car too, whether it's got a large doorway or a narrow doorway. If it's got a narrow doorway, you really want the seat back as far as you can get it. Just the same thing in reverse. First thing you would do is you would have them sit forward in the seat, bring their legs out of the car and rotate until they're facing out of the car. The wheelchair would be sitting parallel to the side of the car as close as you can get it. Again, they can hold on to any part of the car they like to help themselves come up. If you have a gait belt on them, that really is helpful. And we just stand them up, pivot them around and sit them down in their chair. Going up and down a curb with a wheelchair, ideally you should go down a curb cut or up a curb cut, but not every place in Hawaii has curb cuts. Curb cuts are where the sidewalk, edge of the sidewalk dips down and is at the same level as the road or the pavement that you're going to. If you are going to go down a curb, which is usually about 4 inches deep on an average. Sometimes they're a little deeper, sometimes they're a little shallower. It's important to remember which way to go down. And you go down backwards. Okay? So you turn the wheelchair around until the back wheels, the big wheels, are at the edge of the curb, and you slowly lower the wheelchair down backwards. You then have to tilt the wheelchair a little bit so that the footrests will clear the curb as you back away from the curb. Once you've backed away far enough, you can let the front of the wheelchair down and the footrest won't catch on the curb. Going back up a curb is exactly in reverse. You have to tip the wheelchair back first, wheel it forwards until the front wheels are on the curb, and then gently push it up onto the curb using your weight to lift and push at the same time. Takes somebody fairly strong. It's not for the weak. Going up and down ramps with a wheelchair can be very dangerous. Once in a while I will see people flying down ramps with no control, and that's the problem. Is going up the wheelchair is very heavy and it's very difficult to push straight up a ramp. So when you're going up a ramp, we advise you to kind of zigzag up the ramp, to take it in small steps. It decreases the steepness of the slope, and it usually means that most people are able to push their family member up a ramp. Coming down the ramp, the problem is control. If the patient is heavy and you're not so heavy and you're trying to control the weight of the wheelchair plus the patient, then the wheelchair can take off without you. So again, we advise going in a zigzag and taking it more slowly. Takes longer, but it's much safer. Assisting elders with canes and walkers depends a little bit on their functional level. With every elder, we want them to be as functionally normal as possible and to be as independent as possible. And it's really important not to take away the independence. If somebody, however, is very unstable, a gait belt is a really good device to have on them at all times, so that when they are walking, you are not holding their arm, you're not holding their pants, you're holding the gait belt. Now, if they are unstable to one side, then you would want to stand a little behind them and on that side and stabilize them by holding the gait belt on that side. If they are just generally slightly unsteady, then a light touch on the gait belt, or even not touching the gait belt at all and just having it there in case you need it. Because again, independence is really important. A walker is a nice steady frame, has 4 feet on it, and the only thing to remember when you're going down a curb or even coming back up again is that the walker goes first. So the walker, when you're coming off the curb, will go down onto the lower level. Patient will put their weight on the walker, and then their feet will come down the curb into the frame of the walker. Going back up again, it's the opposite way around. The walker comes up onto the curb and the client steps up into the walker.
Walker forward, right step, left step.
Going up and down a ramp with a walker, you can go straight up and down. But again, it's a very steep slope, and if you go up in a zigzag fashion, it's less stress on the client, on the patient. So if you have a right knee that is painful or an arthritic, the cane should be held in the left hand. There are a couple of reasons for that. Number one is when you walk normally, you swing the opposite arm and leg when you walk. So this makes a much more natural gait if the cane is held in the opposite side. And the second reason is that we want to take the weight away from the limb that's affected, not towards it. And if you have the cane on the same side as the limb that's affected, you tend to lean more heavily on that side. So we're trying to shift the weight away onto the better side, the side that can take the weight better. Height of the cane or height of any walking device is when the elder is standing next to the device that they're going to use, whether it be a walker or a cane, and their hand is down by the side. The handle should reach the small bone that's right on your wrist, basically at wrist level. So we got 3 walkers and they're 3 different heights. Brian, come and stand in the middle. What I'm looking for when I'm fitting a walker or a cane or a pair of crutches is that the wrist bone should be level with the hand piece. So this bone here, or the bone on the outside, doesn't matter which, should be level with the hand piece. So this one's too short for Brian. Let's try the next one. That looks better. That's much more his height. What happens is when you put your hands on the handrail, you'll have a little bend in the elbow, about 15 degrees bend in the elbow. Now when he puts his weight down, push down on it, right? He will be able to lift himself off his feet by straightening his elbows. And then when he relaxes, he'll come down a little bit. Let's try the one over there, which I think is too high for you. So this one's way too high. And what that's going to do is it's going to make his shoulders come up in the air and he's going to get uncomfortable up here. He won't be able to push hard enough on the walker. Walkers are becoming more and more common because we're having more and more people living to an older age and therefore needing some assistance with gait. And they give a lot of stability. The problem with most people who are using walkers is they're not really taking weight on them. They're using them for psychological support and balance. They're not really weight bearing on the walker. A walker should be moved forwards, and then 2 steps should be taken to get into the walker. Then it should be moved forward again. 2 more steps taken, moved forward, and progress that way. The problem with that is it's very slow. It takes a lot of time. And what most people do is, especially if they have a walker that has wheels on the front, they tend to just wheel it along like they're pushing a stroller. And they're not really taking much weight on it. If they should stumble or fall, they're probably not going to be able to catch themselves and hold themselves up doing it that way. But it is quicker, and that's the way most people do use it. Transferring elders into bath and shower is a dangerous undertaking because we've got damp floors and bath mats and all those kinds of things. So there are a couple of devices that can really help with that. Number one is a bath bench. And bath benches go across the bath and have a projection that comes out, which is a little seat outside the bath. So that the elder would sit on the outside seat, would scoot themselves across the seat, because it's like a bench, and then bring their legs over the edge of the bath and get into the bath that way. My advice with most elders is to bathe on the bath bench. In other words, to use a handheld shower and to bathe sitting up, because getting down into a bath and getting back up out of a bath is a lot of strain, especially if the person is not very mobile themselves. The second thing that's really important for people taking baths and showers is that there is a non-slip surface on the bottom of the bath and the bottom of the shower. If they are going to be showering down in the bottom, that's absolutely essential for them to have that non-slip surface. Getting into a shower, ideally you would want somebody to be able to wheel directly into their shower, but most people's houses won't allow that, and it's very expensive to have the bathroom converted. It's very similar. There's a bath bench that goes into the shower. They sit on the seat part that's outside the shower, scoot themselves in and bathe, and then come back out again. And handheld showers work really well.
So as we get pretty close, what we'll do is we'll release one of the leg rests. So get it out of the way. Move it. Okay, from here we'll get the chair as close as possible to the shower. Possible. Make sure to lock it. We'll release the other side. And from here, we'll take off the armrest, get that out of the way. From here, I ask her to scoot as far forward as you can. You scoot. Okay. Then once we get into this position, we're going to have her tilt forward. Okay. You can hold on to my forearms for stability. You can push off on the chair with this arm. On the count of 3, we're gonna stand and we're gonna transfer. We're gonna shift your butt over to the shower chair. Okay. On the count of 3, 1, 2, and 3. Up, and over. Okay, from this point, we're going to move the chair slightly away. And then from here, we're going to put one leg in and the other leg. And then make sure you adjust yourself onto the chair. Okay.
Toileting, it can be very difficult because of the size of houses here in Hawaii. Most bathrooms are very cramped. The toilet's next to the sinks, next to the shower, and there's not a lot of space for a wheelchair to be. It's easier if there is a walker. If they can walk into the toilet, they can just walk straight up to the toilet, put the walker over the toilet so that it's now flush against the tank, and then turn around and use the walker as hand rests to let themselves down onto the toilet and to get themselves back up again. If that's not possible, if they're going from a wheelchair, then they're going to need some kind of rails around the toilet to assist them getting up and down, just like the arms on their wheelchair help them get up and down. But it's a problem with space usually. Special tips for family caregivers: take care of yourself before you take care of your elder. If you don't take care of yourself, if you don't take time to exercise, if you don't take time to take a break, you get burnt out. You get frustrated, and that's not good for anybody. You can also get hurt, and once you're hurt, then you are really no use in the situation. It doesn't help much. Second thing to always remember, safety, both for yourself and for your elder. The last thing we want to do is have somebody fall, and safety is the most important thing. Getting organized, getting your area set up, and making sure that there are no loose mats on the floor, no cats in the way. A number of people fall over their animals because they don't realize they're there. And animals are friendly and they want to be with you, but they sometimes can be a nuisance and they need to be locked up while certain things are happening in the house. But I think the main thing is take care of yourself and take time for yourself. And know what resources are out there to give you a break if you need a break. If you don't have family here for some reason, you don't have other people who can take care of the elderly for a while, I think it's important to know the resources, and those are available.
For more information about services, please contact Honolulu's Elderly Affairs Division, 768-7700. Hawaii County Office of Aging, 961-8600. Kona Office on Aging, 327-3597. Maui Office on Aging, 270-7774. Kauai Agency on Elderly Affairs, 241-4470. For more information about training and educational opportunities, please contact your local community college's continuing education program or Kapi'olani Community College's Kupuna Education Center, 734-9108. Mahalo, and thank you for watching Kupuna Connections.